Hello, Dr. Vicki Peterson here. I wanted to talk to you today about bone fractures and osteoporosis risk. We know that osteoporosis is an autoimmune disease, as is celiac disease, and so we know there is an association between the two diseases. But some nice research out of Argentina recently pointed out an interesting fact. And if you think about it, if you've ever broken a bone, and in this study they were looking at peripheral bones, meaning not of the spine, but arm, leg, fingers, wrists, ankles, things like that. And if you've ever broken a bone, the incident that caused it to occur, you might feel, well, because that incident broke your bone, it would break anybody's bone. But maybe not, especially if you have celiac disease. This study looked at about 265 people with proven celiac disease, and what they did was they looked at their history prior to being diagnosed and found that their incidence of having fractures plus the age at which they had the fracture was more often, so they had fractures more often than the control group that they looked at, as well as they occurred at a younger rate. This is a good heads up for those of us with children. If children are suffering from fractures, you might want to look to see if celiac disease or gluten intolerance might be a contributing factor to this. Also, as a note to why to stay on your diet, so many reasons why to stay on a gluten-free diet, but this study also corroborated the fact that this particular group that they looked at were at least 5 years post-diagnosis of their celiac disease, and they found a group that was very, very vigilant about maintaining their gluten-free diet. So they did not cheat and were very, very good about it. And what they found was that at the 5-year mark, and beyond that, the great news was that their fracture risk went down to that of the control group. So you can actually heal by maintaining your gluten-free diet, and you will lower your risk back down. So very exciting news. The reason to stay on your gluten-free diet, of course, but also, as I mentioned, something to look at if someone in your family or yourself has been suffering from any bone fractures, to really look at maybe the fact that it's occurring not only due to some stress, but maybe because the integrity of those bones is not what it should be, and gluten could be the underlying reason why. So I hope you found this helpful. Please send me your questions. I love to hear from all of you. And until next time, I wish you very good health.